healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Well, welcome back to another episode of Coffee with Coker. This is the first episode of 2021 for us, so that's exciting, and it's appropriate that we're covering this particular topic for the first episode of the year. I think we all would agree that we had more than enough commentary, discussion, and news coming out about all the things that were 2020. And while there certainly be plenty of things that overlap or flow into or carry over into 2021 and maybe even years beyond that, what we really want to do is kick off the year talking about looking ahead and the future and helping some of our listeners, our clients really start focusing on moving on from everything that was 2020 and in a way that allows them to be stronger and more successful. And so that's what we're doing today. And so we have with us Max Reiboldt, who's Coker's CEO, and Taylor Cowart, who is a senior associate here at Coker. Max and Taylor actually did an internal presentation that we do here for all of our team at Coker back in December, and we thought it was very appropriate information for the broader audience that we wanted to kick off the year with. So today we're actually talking about the top 5 trends in healthcare for 2021 and specifically what they mean for our clients, for hospitals, for health systems, for physicians, for medical practices, and really anybody in the healthcare services industry, what these trends mean for 2021. So maybe, Max, if you want to get us started, kick us off, and we're going to walk through each of the 5 briefly, and there's certainly plenty more information on each of these if anybody has questions. Maybe kick us off and start us with, give us an overview of the 5, and then maybe jump right into the first one, if you don't mind.
Sure. And thanks, Mark. And it's good to be with everyone again as we've turned the page over to yet another new year. So I think it's safe to say most everyone was not unhappy that 2020 finally came to an end, and we're looking forward to a better year health-wise collectively and post-COVID. So we wish everyone a happy new year and the best of good fortune, first and foremost, as we kick off our first podcast of the new year. And with that said, I'll follow up on Mark's request and talk briefly. We've isolated, and by no means are these 5 all-inclusive. There's, I'm sure, others that we didn't choose to collect and address, but suffice it to say, I think these 5 are prominent on most everyone's list. So in no particular order, we'll talk about post-COVID transactions first. And when we mean transaction, of course, we're talking about some form of affiliation, alignment, integration, whatever word you choose, involving healthcare providers. And we'll run the gamut there. The second, and it's on everybody's mind, certainly on our minds here in Georgia today, as we record this, it is election day, and the political transition that we know we're going to have in Washington, and to what extent is the second thing. The third thing is an interesting concept that's been around now for over 10 years, but hasn't really moved as much, but we think it may start to, and that's value-based arrangements, value-based reimbursement. The fourth is very much a standard bearer in terms of any changes and probably would apply to virtually every year. And that's, generally speaking, how operations and improved efficiencies are going to be such an absolute high priority as such going forward. And last but not least, and this is one that is a derivative, we think a largely derivative from COVID. There's not much good from COVID, but one thing is the concept and utilization and reimbursement for telehealth. So with those little intros out of the way, let me talk a little bit, and I want Taylor to jump in here as well, about post-COVID transactions and what we think they'll mean, looking into our crystal ball a little bit. With that said, we think that a lot of this will depend on how fast we move away from COVID. One might argue, as we are just at the beginning of the new year, that little has changed, that COVID is still very much out there and a concern. I think it's safe to say that we know a lot more about COVID than we did 9 months ago when it first sprung its ugly head. And with that said, as we move into 2021, I believe we are somewhat safe in assuming the pickup in transactional work will be there. Now, it may not really manifest itself until the second half of the year, in the sense that it will take the first half of the year for a lot of healthcare providers, hospitals, physician groups, private equity firms, et cetera, to continue to overcome and get over, if you will, the business effects of the COVID pandemic. So we believe, and again, we don't claim to have all the knowledge of the future. It's just our experience and whatnot showing through here, that there will be a pickup in activity in transactions between various healthcare providers, and that most likely will not really start to show itself until the latter half of this year, and then potentially move into 2022. But one thing we do know is there's a lot of opportunity to make a lot of transactions and complete them between physicians and other physicians, between physicians and hospitals, physicians and private equity, hospitals and other hospitals, and the list goes on and on. So with that in mind, we think that the activity will pick up. And Taylor, I know we shared a slide. We can't do it today, but you might want to talk through a couple of the slides that we drew from in our recent presentation internally about how the percentages have been affected in physicians and independent practice, and how they've changed even as recent as the last year or two.
Yeah, absolutely. So I think, the first thing that Max was referring to is kind of this shift that we're seeing in practices becoming more interested in partnering or being acquired. And it's been interesting this past year. What we've seen, especially right when COVID started, was kind of this uptick in practices that had been historically extremely independent, moving to seeing the benefits of being acquired. And so a lot of these practices, again, we obviously saw this happen over the last few years, this massive shift to being, affiliated with a hospital. Well, the ones that remained private were private for a reason. It's not that they didn't know that this was an option. They were choosing very passionately to remain independent. And so what's happening now is we're seeing this, that category of people, unfortunately, because of what happened with COVID, it took massive financial hits and kind of had to figure out what was the best option for them. And so some of the practices that had been historically extremely independent are now considering these options that they didn't consider previously. So that's kind of the interesting thing there. And we're seeing that in the numbers of practices that are now looking to partner more with a hospital, not necessarily be employed, but there's obviously lots of different options there, but just looking for that stability that a hospital can provide. To that end, when hospitals are now they're looking at a practice that's had a likely very hard year. And so, this is not only just hospitals acquiring, if it's a private equity group looking to complete a transaction, et cetera, how do we look at 2020? Is it truly an outlier? And, we have clients that did very well in 2020. I had a client say the other day that they're having one of their best years yet because they were able to get on top of the testing early, and primary care practice that just really capitalized on this. And so it's not necessarily an outlier completely negatively for all practices. But how do we adjust that in our due diligence? How do we normalize these, the analysis of financial statements? What does it look like with practices that accepted the government stimulus programs? Is that going to be forgivable? What's that going to look like? What is the risk associated with that as we complete the due diligence? So all of these things are very nuanced and frankly still very unknown. Again, to Max's point, we're still kind of in the thick of COVID. And so what does this actually look like in 2021 and beyond? How will we continue to be impacted in 2021? And how do we kind of consider this going forward?
Yeah, I think that's interesting. And you alluded to the varied forms of affiliation and alignment. And I think you're going to see a lot of this play out in such a way that not only are more groups may be open to affiliation than before, but they also may be open to other forms of affiliation and alignment rather than just a full-on sell to a hospital or sell to a private equity sponsor or something like that. There may be other options, which could be a little bit of a positive for those groups needing some assistance or needing a resource for affiliation. We've done, and Coker has a lot of information on the very long range or wide range of alignment options. So if there are questions, obviously listeners can reach out to any of us to get that information, but there are a number of lists. I think it segues well though. And Max kind of alluded to the political transition and the things going on in Washington and all over the country from a political change of power standpoint and what that means for policy. And anytime, as we've seen in any years past, any election, and particularly during a transition, there's always fairly significant impact or changes on the healthcare industry, whether it's on reimbursement or if it's on subsidized healthcare and CMS funding and whatever it may be. There's typically going to be some changes, and I think we can only expect that as we go into this kind of new season post-election. Max, do you want to speak to that?
Yeah, I think regardless of how the Congress is made up in terms of majority, the new presidential administration, Biden, will look to expand coverage specifically in Medicare, and will ensure some form of transparency and price stability. And needless to say, we'll also have to deal with the healthcare matters that relate to COVID and the treatment of COVID. So I think with the Democrats in control of at least one house, if not both, and the presidency, I think there will be a pretty pronounced shift toward more governmental involvement. Now, I know that's a very general statement, and probably everyone's wondering, well, great, what does that mean? I don't know. I don't know for sure. Politics, of course, is not something we're going to get into, nor should we, but I will say that politics create strange partners at times, and in order to get certain legislation through, the Democrats don't have enough control and won't of either house to really just take the agenda that some apparently within the Democratic Party want to move significantly to the left. And I just don't think they're going to have the votes to do that. Moreover, I don't think there's the demand from the public for that. So what does that mean? When I say more governmental involvement, more control, but then again, they can't move the dial too far. Well, I think that we will see some things that will relate to, and this goes back to the original Obamacare legislation, I think, where we'll see a lot more, not just government involvement, but individual mandates that will be expanded on. I think we'll see Medicare reimbursements for prescription medications accelerated. Again, when you consider post-COVID and the fact that a lot of older people, at least we're told, are putting off seeing the doctor and going to get treatment for other illnesses that will now come up and possibly be more severe. I think all those things will be out there. I think there'll be an attempt for a greater public option for the development of a government-run program. And so all of these things point to some changes. It could be a lot or somewhat more involvement. And keep in mind that, try as they might, even the Republicans in the last 4 years were not able to change Obamacare. I mean, it pretty much stood on its own. There were a few things changed by executive order, but not much. So the question begs, what will happen with the political agenda? And again, I've tried to be somewhat, I guess you would say, aware of the fact that we do have a new administration, a new political philosophy, if you will, but there's not enough there, at least not now, to really move it. And by the way, there's another election in 2 years. But clearly, I think, Mark, we've got some interesting times ahead of us politically, and it'll certainly, healthcare is going to be at the top of the list.
Yeah. Well, you alluded to the fact that a lot of the things health policy wise from during the Trump administration were changing or reversing some of the things from the Obama era Affordable Care Act. And I think at the very least, Biden has made it pretty clear that those pieces would, again, at the very least, be reinstated. One other thing that kind of jumped into my mind too, this has nothing to do with political transition or the results of the elections, but from a healthcare policy standpoint and regulatory perspective, we've talked a lot towards the end of 2020 and continue to work with clients on the changes that came from CMS to the updating the E&M codes. And there's a lot there that was enacted as of 1st of January that or they went into effect as far as different, not only coding requirements, but some alleviation of challenges as it relates to coding that have been there, or limitations around codes in the past that they've made some improvements on. So I think that's one thing at the very least that we know is here. And again, it has nothing to do with the election or political transition, but it's just another example of the regulatory environment impacting the industry, I guess. As we jump forward, it kind of tees up the third trend that we want to talk about. And Taylor, maybe just give us a little bit of overview of how you think value-based arrangements and value-based reimbursement is starting to take a little greater hold on the industry.
Yeah, so, it's interesting coming from that conversation about the political transition and the differences we expect to see there. Value-based care really became, I think, a big term with the Affordable Care Act and Obamacare and everything that came along with that. But it's obviously been milling about the industry for a really long time. Well, when it came about, we really saw this had a ton of bipartisan support. I think that if we look at the numbers, if we look at the healthcare industry in our country, there's obviously room for improvement from a value-based, perspective. And so one of the things that we've seen is that both sides of the aisle agree, we don't want to necessarily move completely one way, but we do want to try to move the dial to reducing the cost of care in this country. And so value-based care continues to remain a prevalent topic. And so, we expect to see this change. We just, I think in the last few weeks, we saw Biden appointed his new Secretary of HHS, and that, will obviously have an impact on some of these value-based designs. But again, we expect to see a lot of the same things that have been happening, this continued trend toward value-based reimbursement, but not necessarily a massive push there quickly. But they'll probably review a lot of the government programs in place right now and see which ones have worked well in the past and need to be revised. So we expect to see a lot of those programs kind of change or adjust in the next few years as they get settled. But we expect it to still be something that's discussed ongoing. Max's point earlier, Obamacare, and for what it's worth, is pretty much continued on in a lot of ways. And so, some of the things that have come up under that kind of tacked on to it, we expect to continue seeing. And I'm kind of referring to MIPS and APMs and those type models that we expect to continue being relevant in the next few years.
Correct me if I'm wrong, but when we talk about value-based arrangements, we're not suggesting fee-for-service and traditional arrangements are just going to disappear and go away. But I have to think COVID and everything that we went through in 2020 as a result probably made the value-based arrangements, the value-based model, it probably gave it some more validation or made it illustrated why those could be really beneficial. Would you all agree?
Yeah, absolutely. And to your point, absolutely. That's kind of what I was saying earlier. We don't expect this to necessarily increase in pace a ton. We expect to see kind of this same metered interest in how do we do this without completely undermining the current system. so no, we don't expect it to be a flip switch overnight type thing. But to your point, yes, COVID underlined a lot of the necessity for us to shore up our healthcare. And one of the things that really was interesting to me, at least, that came about, and of course we all know about this, but that I expect to see incentivized more so from that value-based care is access for care in our rural and lower income communities, and how we really expand that access. I mean, if we look at the disparity in healthcare and how it impacted COVID response, I mean, you can talk to any hospital in the country and they're going to explain that was a major impact on how people responded to COVID treatments, et cetera, and the levels of COVID in communities. And so how we really work to get healthcare to these populations will be really, I think that will be more incentivized maybe than previously, because it was so highlighted in during the COVID pandemic.
Well, let's talk about the impact then on operations and efficiencies, because I think that's something we can all agree that every group and hospital out there, just like every other business in any industry last year, had to really not only make significant adjustments for and make necessary changes on the fly as we were going through the whole COVID thing. But I'm sure there have been a lot of lessons that we've learned in 2020 that we can kind of carry over to prepare to be stronger, more resilient, more flexible to change and outside stimulus as a result of those experiences. So maybe speak to what you guys think could, Max, maybe you can tee us up as far as what you think we can see or expect from groups and hospitals on the operations side in 2021.
As I said at the beginning, introducing the 5 topics, this is one that will never go away, nor should it. But I think it's particularly important at this point in time in our industry and our country's existence, and that is for healthcare providers to really get their efficiencies up, to lower their cost. That's part of the theory, not to go back to value-based reimbursement much, but that's really a lot of what it's based upon, is to try to provide or bend the cost curve, as we call it, and provide high quality care at less cost, or optimal lower cost. And to have the two together makes a lot of sense. Well, hospitals, medical groups, surgery centers, diagnostic clinics, you name it, all healthcare providers these days, if they're not looking for ways post-COVID to save on overhead and cost and do things more efficiently and still obviously maintain high quality care, if they're not doing this, they're truly not in the real world. And so the question is, well, where do we go? What avenues do we have? And the answer is, well, it varies with the organization. For example, a critical access hospital, which we all know those are vitally important facilities to our country's healthcare, particularly in smaller towns where they usually reside, have limited resources. They have limited service lines, as it were. And so they have lesser opportunity in some ways to lower costs. And frankly, they're organizations that have probably through the years had more responsibility, so to speak, to maintain more efficiency and lower costs. With that said, personally, as consultants that work with all types of hospitals, including CAH, critical access hospitals, we're finding that, yes, there's still a fair amount of opportunity there in various forms and fashion. And so it's unfortunate that in some cases, and frankly, this is the case with some smaller rural hospitals in particular, that they have to get down to the point of viability, meaning are we going to stay open or are we going to close or significantly cut back in order to really focus in on cutting costs. Now, one of those areas that I want to focus on, and I'm not picking on our physicians and other providers in that realm, but a significant amount of the expense of doctors and related APPs and so forth comes in the form of their compensation. And believe me, I'm all for physicians and APPs making the most that they possibly can. And we back that 100% with our work. But with that said, as long as we still are in a mostly fee-for-service environment, as we are, and even under a value-based structure where costs, as I've already articulated, are still very important to the bottom line, we have to have physicians, APPs, et cetera, that are totally in sync and focused in partnership, whether they're employed or private, doesn't matter, with hospitals. And so one of the things that we think is going to be incredibly important and kind of spills over, these all overlap and interrelate to the first topic of transactional work. But we really think that physicians and APPs are going to have to, like never before, work with, and it goes both ways, hospitals with them on becoming more efficient, if it is fee for service, seeing more patients, generating legitimate, legal, compliant forms of revenue. And then, of course, at that point, they're justified in sharing in that through their compensation plan. But the days, Mark, of guaranteed income to physicians and other providers without some understanding and expectations of corresponding performance are truly gone. I want to say one other quick thing, though, and we won't just pick on the doctors, but the administrators of hospitals that we work with and department heads and all, they're all going to have to take on the same attitude, which is that they're going to look for ways to cut costs. And frankly, a lot of their income is going to be, I think, more so at risk. We work with a fair amount of projects on administrative compensation and bonus systems. And so I think here again, no one is immune or gets out without consideration of this whole item of efficiency. And so I think that's going to be perhaps the single most impactful area of all five. Some would disagree with me on that, but I really believe that there's still a lot of room to wring out overhead and cost in our healthcare provider system.
Yeah. One of the things that jumped out at me in you all's presentation, and Taylor, if you don't mind speaking to this, but to Max's comments around performance improvement and compensation, there were some really interesting statistics that have come out of some recent studies amongst hospitals. But maybe, Taylor, if you'll just briefly speak to a couple of those, because, again, I think some of those areas of response and feedback from administrators and people in the industry tie directly to what Max just said.
Sure. And this is not research that we have completed internally, but that we've found through resources online and through our peers. But, one of the things that we saw is 95% of hospital administrators expect to roll out performance improvement initiatives. 73% are likely to boost physician awareness of costs. 34% are likely to institute global compensation cuts. So again, those are just a few brief statistics that really underline what Max is referring to, that there is awareness of costs and that this will continue to be something important as we move forward.
Yeah, and those are directly in response to the negative impact on revenue as a result of the COVID pandemic. So, and those don't just magically go away. As you said earlier, we're really still in the midst of that. So if there is going to be a recovery for healthcare organizations like hospitals and physician groups, there's definitely going to be some changes that come along. And I think a lot of those are going to be centered around cost or at least tied to it in some way. Which really brings us to, I think, one of the things that has been a kind of an underlying theme or undertone of all five of these, or the previous four, is the role that telehealth has played and the leap that telehealth made in 2020 as a result of the COVID limitations. So maybe speak to that, Taylor. I'll let you start. But I mean, as we think about all the four other areas, whether it's operational efficiencies, whether it's physician compensation, whether it's valuation and the impact on transactions, the presence of telehealth is here. Would you agree?
Yeah, absolutely. And don't want to step on the toes of our colleagues that have gone before us. Coker's done a lot of research on this earlier in the year, and so we definitely pulled from their research here. But yeah, I know it's absolutely going to be massive moving forward. And I want to temper that a little bit to say we do expect, and we've already seen that as healthcare organizations open back up, there's about a 3-month period where, there was truly a complete stay of elective healthcare. And really all organizations had to start considering, how do we do this? How do we see patients? And so there was this literal overnight transition to telehealth. And in fact, really early on, we saw, some compliance. They really pulled back and said, some of the things we've said about HIPAA, et cetera, we'll ease up on for these next couple months, and really just allow organizations to meet their patients where they have to for the foreseeable future. Now, in the next year, what we expect to see is that, and we've already seen it a little bit, as organizations have opened back up, patients are more comfortable still going into the office. And when I say patients, I really mean our older generations and people that aren't as comfortable with technology. But as we know, our younger generations are very comfortable using technology and would prefer to do a lot of things in that capacity. So we have seen a slowing of it more than we saw early on. But people talk about, COVID absolutely improved and accelerated telehealth adoption by decades. And so it absolutely is massive in these, in the COVID impact to operations. So, one of the things that Coker found was that 94% of respondents in the survey we completed agreed that telehealth will be essential to the delivery of healthcare moving forward, which again, I think if you've done this survey last year, even, this would be a significant uptick. But 70% of respondents said that telehealth was either poorly integrated, somewhat integrated, or currently standalone, but plan to be integrated with existing technology platforms. So there's a ton of room. Again, people just kind of scrambled to let it happen and to put it in place with not a ton of foresight into, how do we make this work seamlessly with our existing technology platforms? How do we protect our patients from a HIPAA standpoint? What actually is the best technology to be using, as opposed to just what's the easiest to get in right now? Those type things. So yes, it's completely increased. We expect there to be kind of a step back in the next year and make sure that we're doing it, but we're doing it right.
Yeah. I think it's safe to say it's here to stay, but we're moving on from the be quick to scramble and get an interim solution. We're moving on from that to, hey, we need something that is not just works, but it works well. It's compliant and meets all the compliance requirements. And it integrates well with everything else we do, because we can't live in a reactive environment as far as how providers treat their patients forever. So I think this is going to be something that we're still seeing some adjustment around, even though I think all of us would agree it's here to stay. Max, did you have any comments there?
Totally agree. I think it's amazing how the paradigm has shifted toward favorable treatment of telehealth with COVID. And interesting to note, I think you all alluded to this already, but the payers, including the government, were the first to step forward and change. Heretofore, there was, frankly, not much out there to give an incentive to do telehealth in forms of reimbursement. So I think the efforts that went into shifting to telehealth out of need from COVID were recognized, and thankfully the payers are coming around, including the government taking the lead with Medicare and reimbursing for it. So I think it's here to stay. I think the technology works, and so why not? With that said, I think just like there's going to be a maybe somewhat gradual shift to more and more transactional work post-COVID, I think we'll see a shift back where less telehealth will be delivered, particularly when it's more accessible and convenient, and even preferred for the patient to have direct contact with the provider and vice versa. So I think we'll see a little bit of that, but clearly telehealth has tremendous pluses when it comes to rural communities. One of the areas that I've always felt telehealth has a great deal of applicability is in mental health and behavioral health services. Many of the rural communities simply do not have the providers that are professionally trained in that area. And so the care is essentially non-existent, which is not good. And or perhaps the primary care physician tries to do some of it out of simply no one else there, which is equally not good. And they don't want to do it. So telehealth has a lot of application in that regard and many others. And I think, again, if we're looking for certain clear skies in the clouds of COVID, this is one of them. And I think it'll be around, but probably will go back down a little bit in terms of the total percentage. The last thing I'll say about it is I saw a percentage, and I've seen it 2 or 3 times. Supposedly, those in the know are saying that when the dust settles, that we'll have about 25 to 30% of our healthcare delivered through telehealth or some sort of remote care services. That's still pretty high compared to pre-COVID. I think it was somewhere around 2%. So it's definitely had a major impact and will again in the future.
Yeah, I would agree. And again, we've talked a lot throughout 2020 about telehealth, and Taylor referenced a survey that we did amongst our clients back in the summer of 2020, and we can make sure the report on that is available if anybody's interested. But what I think is interesting and perhaps encouraging as we start off a new year is with any times of struggle, I think we see, or it's very encouraging to see the emergence of greater strength and improvements coming from that struggle, kind of that iron sharpens iron mentality, I guess. But with all the bad that came with 2020, and frankly that we're still in the midst of, even here now in 2021. We're already seeing innovation emerge and changes that have been made that will, I think, strengthen us more in the future. And we've talked about 5 things here today, 5 trends that encompass really a lot of different things. But there are a number of trends I think we're going to continue to see, and whether it's on the technological innovation side, we talk about in the past artificial intelligence, AI, and implemented with more greatly in healthcare, and or if it's on the just changing of the system towards more consumerism, more value-based structures and models, as we've talked about here, the financial impact from all this, and how we can hopefully avoid such a significant negative financial hit for those that experienced it in the future, when whatever the next crisis that hits, whatever that may be, we can be better prepared for it and hopefully not have as much of a negative impact. But there are a number of these things, I guess, is my point. And I think we'll definitely continue to monitor these 5 areas. Any closing comments that you guys wanted to make here as we bring it full circle?
No, and I think we've mentioned it, kind of throughout this, but we've talked about the 5 trends here, but those are the top 5. This was a massive year of change. This was a year that brought upon a lot of learning experiences for organizations. And while it brought forth a lot of challenges, it also brought forth a lot of opportunities and areas that we expect to see more focus on in the coming years that maybe wouldn't have gotten that due concern if COVID hadn't occurred. So, again, not that obviously we all would prefer if COVID had not happened, but there are huge opportunities here for organizations to really get kind of ahead of the curve in the coming years as we respond to more ongoing and timely concerns of the communities we serve.
Yeah, I agree totally. And I'll just say in closing, the mere fact we're doing this remotely, I think you're in the office, Mark, but you're an exception. Taylor's at home. I'm at home today, although sometimes I'm in the office, is illustrative of kind of the change. And I don't see it going back to the way it was. That is not to say that healthcare providers will all of a sudden work from their homes, because they won't. But a lot of people will. A lot of administrators will continue to do more of that. And so I think our entire way of being is forever changed as a result of this pandemic. And maybe it's good, maybe it's not. I guess we could debate that, but it does spill over into our healthcare industry. It's exciting to think that we as Americans can rebound from this, and certainly other countries too. But since we're really talking about our healthcare system, I think it's been tested. And I'm not saying it hasn't been damaged in the sense of financial losses and so forth, but I think it's safe to say that we are, as a healthcare system, still very viable and have a promising future. I personally hope that we'll continue to learn from the events of 2020, and we can learn from our mistakes, we can learn from history, and we can move forward even stronger. And I personally hope that we maintain our private system, because I think it still is the best, and we'll work hard to support whatever the government does as well. And certainly they have a role in the whole healthcare delivery system. I'm not saying otherwise. So I'm excited about 2021. I think we all have a lot to look forward to, and let's keep the glass half full, not half empty, and move on and get through this process together. If we can get through 2020 with all of its uncertainties, I can't imagine that we can't encounter virtually anything else that comes up in the future. So it's been great to be with you all today, and hopefully it was helpful for those listening.
Yeah, no, well, thank you. I think that sums it up well. And for everyone listening, we'll continue to monitor these 5 trends, and as well as obviously many others. But I think this is going to be an ongoing conversation. So we'll look forward to continuing it as we continue to move forward into 2021. But thank you all for listening. And Max, Taylor, thank you for joining today. And we'll look forward to continuing the discussion in future episodes.
You bet. Thank you.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.